This is a simplified explanation of a CPR scenario. This does not take the place of a class. It's highly recommended that you take an actual certification class to become proficient in the knowledge and the hands-on skill to perform CPR.
This is Mary Lou, and this is Resource, the number 4, Care. And Resource for Care is a resource for seniors and their adult children where we interview professionals that provide care and teach seniors and their families everything we know. So today we have Lisa Curry. Welcome, Lisa.
Hi, thank you.
And she is the owner and founder of 901 Vital Training. And we're here to talk more about seniors, but I understand you have quite a few training, half a dozen trainings or so that you provide. Why don't you give us a little insight into that?
I do human CPR,
Okay.
first aid. Been doing that for about 8 years now. And then I added on to that last year with a babysitting classes with CPR.
Okay.
And that seems to be a big hit for junior high school students that are wanting to start
Okay.
babysitting. And then, staying home alone, that kind of thing.
Right.
And then I just became CPR certified for pets.
Oh, wow.
First
a lot of our
aid.
seniors have pets.
So we have a good group, good group class for that.
Okay.
That would be fun.
Yes.
And then, just knowing how to take care of them to get them to the vet may
Right.
increase their chances of
Yeah,
survival.
of surviving a health incident.
Yeah, and then
Okay.
and then also there's a grandparents class, grandparenting, I guess you'd say 101.
Okay.
Been a while since you've been had those
Right.
little ones, and little refresher course, and also goes into first aid and CPR for infants.
Okay.
Which is always a
Yeah,
good
really
thing to know.
helpful. Yeah. We usually start out right with the educational topic, but we were chatting a little bit before we started recording. And I just, especially with the grandparent course and the one for the pets, I wanted to make sure people knew that you had that available. So why is knowing CPR important? Why do you think it's, what's your take on that?
Well, I say CPR is something that everybody should know, but you hope you never have to use it.
Yes, that's true.
But for every minute that, if you find somebody down and you don't do anything and you call 911 and you wait for the ambulance,
Right.
for every minute you wait, their chance of survival decreases by 10%.
Wow.
And on average, it takes 4 to 10 minutes for an ambulance to arrive. So if it took
That's
them
a
10
lot of
minutes,
percentages.
Yeah. Yeah. So the quicker you start CPR
Yes.
and have that oxygenated blood going through the body
Right.
while you're waiting on the ambulance, that increases their chance of
Sure.
survival. And then, and if you're somewhere where there's an AED available, that's even better.
Okay. And explain to our
An
listening.
AED is an automatic external defibrillator. So
Okay.
if the heart, if the problem is the electricity of the heart is
Right.
off, and we can give them that shock, we
Okay.
can hopefully get the heart back into rhythm.
Okay. So what would you say to those people that maybe are just watching this or listening, but they've never done CPR or seen it done? They don't have benefited from your classes, and they're fearful. What would you say to them? I mean, can they do such a bad job that it would be worth not doing? I mean, I just wanted to get your input on that.
No, I mean, there's stories of, on the internet, everything, Facebook, about people doing CPR. They've never had a class. That one guy only had seen the scene from The Office, which is a famous
Yeah,
scene,
TV.
funny
Right.
scene. But just, putting your hands in the center of the chest,
Right.
and compressing, you're trying to go 1/3 the depth of the chest, which is about 2 inches.
Okay.
And you try to go, 100, 120 beats per minute, which, like the famous song, Staying
Right.
Alive, if you have to sing that to yourself
Right.
to go at the right beat, then do that. If you can give breaths,
Right.
30 beats, 2 breaths.
Okay.
30 beats, 2 breaths.
And you mean
can do
covering
that.
their mouth and breathing into their mouth?
Yes.
That's what you mean by breaths.
Yeah, open the airway and breathe, pinching the
Okay.
nose and
Right.
breathing into the mouth.
Okay.
But if
Well-
you can only do hands-only CPR, that's an option.
Right. So explain to me the staying alive, because I've heard that, but someone who's like, has us casually mentioning it, they're like, what are you talking about?
So you're doing your compressions to
Right.
you're trying to get them at the correct beat.
Right.
And that song is the correct beat.
Okay.
So singing the Bee Gees
so let's do
song.
it. So how do you,
You're not going to make me
come
sing.
on, we'll talk it. We'll talk it.
So 1, 2, 3, 4, 5,
How does it
6.
start? Come on, you're a music guy. Staying alive, staying alive.
Yeah.
Okay, that just gives people, especially on our podcast, because they're
Yeah.
not going to see us.
That's right. I
So
keep
that's
forgetting.
why I'm making
Yes.
us say it more, so that those people who are driving and learning at the same time, now don't watch the video and drive, but driving and learning, they have an
Right.
idea of what we mean. That's all.
Exactly.
I didn't mean to put you on the spot.
Singing is,
Singing.
that's why I was in the band, so I don't have to sing.
What instrument did you play?
Saxophone.
Okay.
Yeah.
We had a trumpet and what did my daughter play? I think she played saxophone. Yeah.
Yeah, it's great.
So when you do the training, how long does it take for someone to learn what they need to do well? Like, is it a long drawn out? Do they have to come, 3 weeks in a row?
Oh,
or-
no.
Help us understand.
Well, there's two, you can have a class with just adult. You can have
Okay.
a class, usually most people want adult, child, and infant CPR. And so that would be around 3 hours to
Okay.
do all that. Now, there's also what's called a blended class,
Mm-hmm.
which is great for someone, especially if they've had CPR before.
Okay.
And they can watch all the video stuff at home
Okay.
and then come to me and
Right.
just do hands-on. Do
Okay.
the hands-on check-off part.
All right. So if they do a 3-hour class, do they end that class being certified?
If they do the skills correctly,
Right.
then they are.
And they have to demonstrate.
Right.
It's not a written test or.
For this class, no.
Okay.
Yes.
All right.
So yeah, they have to be able to successfully perform.
Mm-hmm.
They will be able to be checked off and get their certification card.
Okay. Well, do you want to do a little bit of a demonstration? And
Sure.
of course, we'll tell our podcast audience that you have to go to the website, which I'll plug again, which is resource4care.com. And all of the YouTube recording links are there. So if you do want to go back and see the mystery of what we're doing, since
See
you're not.
his awesome outfit that he has on.
Yes. I'm sorry that he lost his limbs.
Yeah, he's got
He's got issues.
No arms, no legs. So are we okay here in the camera? So we have Mr. Jones here in the middle of the aisle at Costco.
Right.
And so your first step one is you want to make sure this is scene is safe, because you can't help him if you get hurt. So
I have a question already.
Okay.
So, unfortunately, I just had someone recently fall in my home. Mm-hmm. And she fell on her side.
yeah.
Now, she didn't hit her head and lose consciousness, but if she had, just the first aid I've taken says don't move someone, but if they're not breathing, you kind of have to, right?
Yes.
If
they're
breathing
not
breathing is more
yes.
important than.
You just want to. Was anybody else at home with you?
Well, we had a whole bunch of people there.
So she was on her side.
Yes.
So you want to support. You're worried about head and neck injuries. So yes, you want to support and help get her on her back without trying to move her back.
Right,
and neck
like when
at
you
all
scoop up a
possible.
baby, you're always supporting their neck. You want to do the
Right,
same
right.
with someone who's fallen.
So if you can get her on her
Okay.
back with
Yeah,
this
she
little
actually ended
movement.
up dislocating her shoulder because she had knee replacement and didn't want to fall on her knees. So
Poor thing.
I know. But that was always a question. Like you worry that
Yeah.
there's some kind of spine or something injury, but that makes sense. Okay, didn't mean to interrupt. But
No,
that was
that's
popped into
fine.
my head.
So yeah, you want to make sure the scene is safe. So that's
Yes.
step one.
Okay.
So step two is to see, will he respond to you? So, Mr. Jones,
Right.
hey, are you okay? So
Right.
he should blink,
Yeah,
startle,
yeah.
something.
Have
if
some
he's-
kind of reaction.
Right.
Okay.
So if he doesn't, something's wrong.
Yeah.
So we don't know if he needs CPR, but there's something wrong, so we want to get medical help coming.
Right.
So you would
That's
yell
the first thing.
and
Dial.
tell if somebody comes and say I can help, what's going on, you tell that person go call 911, and if you can find an AED, bring it.
Yeah.
So if you had a bunch of people come, you want to designate one person to call 911.
Okay.
Because you don't want 15 people
Yeah,
calling
tying up the
911.
line.
Right.
That makes sense.
So,
That is so smart. Okay.
so say go
I
call
learned something
911.
already. Okay.
Go get
Two
AED.
things. All right.
This is a simplified explanation of a CPR scenario. This does not take the place of a class. It's highly recommended that you take an actual certification class to become proficient in the knowledge and the hands-on skill to perform CPR.
All right.
So, we hopefully have help coming. So our next step is to see, do we need CPR? And we figure that out by looking to see if they're breathing.
Okay.
So I'm gonna look. I could even put my hands on the chest to see if I
Right.
feel for a breath.
Okay. And the
So-
chest should be rising and falling at some rate if they're breathing.
So we're gonna feel and look for 5 to 10 seconds.
Okay.
So for at least 5 seconds, no more than 10 seconds. So if it's been 10 seconds and he's not breathing, then we
Right.
need to start CPR.
Okay.
So I'm going to go ahead and, you think this is awkward, but you've got to do it. Especially if somebody brings an AED, we need, the pads cannot touch anything but the skin.
Oh.
So we've got to get the clothes off.
Okay.
If
And you do that regardless of whether you have the IED or.
Well, no, it is possible to do it without it.
Okay.
So, but for our purposes, for you to
Okay.
see the chest and
Yeah,
everything,
yeah.
I am going to go ahead
Okay.
and take his lovely, beautiful shirt off here.
Did you dress him? This is a very nice shirt.
Consignment sales, they're the best. That or Goodwill.
Okay.
So I'm going to find the center of his chest and put one hand there
Right.
and another hand on top.
So you're putting one hand flat and then you're grasping on top of your
that.
first hand.
So
Okay.
the purpose, as long as you've got plenty of power there,
Yes.
put your hands as you want. So for our mannequin purposes, I say you draw an imaginary line between the two nipples and put
Okay.
your hand in the center.
Okay. That is a
And-
good visual for our listeners.
And then I'm going to put, which our situation here is not perfect, you would want him on the floor
Right.
for, for us to do the best
Yes.
job he could. But for
Right.
our purposes today,
Yeah.
you're going to put your shoulders over
Oh,
your
okay.
hands.
Yes.
And that's going to help gravity help push down.
Gives you some leverage to push. Okay.
And you want your arms straight.
Okay.
So in this position, if you're on the floor,
Right.
shoulders over
You're
hands,
probably on
arms
your
straight.
knees at this point.
Right.
Yeah. Yeah.
So I'm not really able to do it on the table.
Yeah.
But I would go down. Your goal is to go down at least 2 inches on an adult,
Okay.
which should be 1/3 the depth of their chest.
Okay.
So
That's
we would do
interesting.
that
Yeah.
30 times.
Right. Right.
Now there's a thing called compression only CPR where you would just do compressions.
Mm-hmm.
If that's, somebody you don't know,
Right.
feel awkward giving them breasts.
Yes.
As long as you keep the blood flowing and
Right,
going, to
right.
keep the
That buys you
oxygen
time.
going to your brain.
Yeah. Yeah.
And so, but if you were, if it was a loved one,
Mm-hmm.
we would go and give 2 breaths.
Okay.
And so I say, you're going to karate chop the forehead.
Okay.
Put your pinky side of your
Right.
hand
So
right down the
up,
forehead.
right above the eyebrows. Yeah.
And then pinch the nose.
Okay.
And take the other hand and put it on the jawbone.
Okay.
And tilt that head back.
Tilt it back.
And that opens the airway. Mm-hmm. So a lot of times the tongue's closing off the airway.
Okay.
So you push the airway open and that
Right.
opens your airway.
Right.
And then we're going to seal his mouth with your mouth.
With your mouth.
And give 2 breaths.
Okay.
So
Can I ask a question?
Absolutely.
I do remember from when I was a lifeguard many, many, many years ago, or at least was certified to be one, that you check the airway to see if there's anything blocking it. I guess because we're at the pool, you know, a lot of kids might be chewing gum or whatever and
Yeah.
swallow it. Is that part of this, or?
If it was a choking incident,
Oh,
we would
I see.
teach,
Okay.
yes, before you give a
But if
breath, you
somebody
check.
just passes out and
You're going to just assume it's a
assume it's
cardiac,
a cardiac
issue.
issue. Okay. All right.
So if you remember CAB, compressions,
Right.
airway, breathing,
Yes.
CAB.
Okay.
So we would give 2 breaths. So I would give him a breath,
Right.
and I would look to see if his chest rises.
When you breathe in.
So that way I know the air's getting in. If it
Okay.
doesn't rise, I'm going to let his head go back and reposition it again
Okay.
and try again.
Okay.
And then after 2, should be 10 seconds.
Right.
And I would go back to compressions.
Okay.
Now, if his chest doesn't rise at all, I don't keep trying.
Okay.
Compressions are more important.
Oh, I see.
So
You don't
after-
keep trying to blow air. You keep on going with the
Yeah, if it's
circulation of
been
the blood.
10 seconds,
Yes.
go back to compressions.
Okay.
We can try again when we go back to do the next 2.
Right. Right.
But getting that blood to continuously flow,
Right.
get to the brain,
Right.
is more important than us to keep trying,
Okay.
keep trying.
So what is the intermittence of compression stopping and going? Like how long are you compressing? Then you're taking a moment, or
You're just trying to move as quickly as you can.
okay.
Yeah.
Do you go through that whole song, and that's the speed? That's not really the length of time, though.
No, it's
Okay.
just 30. You're gonna
30.
You want to count out loud 30.
Okay.
One,
I missed
two.
that. I don't know
Yeah,
if you
yeah.
said that. But I missed that.
Maybe I didn't make it clear
We'll play
enough.
back the recording. It doesn't
You wanna
matter.
Make it 30.
30. Okay.
30 to 2.
Okay. 30 to 2. Okay. Compression, airway, and then what's
Breathe.
the B? Breathe.
Breathing.
Okay.
Yes.
Checking the breathing. Okay.
Yes.
Okay.
So you're doing that, if somebody did bring you
Yeah.
an AED, then you would stop what you're doing and put the AED on.
Okay.
And the AED is
Yeah. What does that look like?
well, I have a toy,
Okay, that's fine.
and every AED is a little different, but they're all the same.
Okay. They
So-
do the same thing.
You turn it on, and it's going to tell you what to do.
Okay.
So all you have to do is relax and calm down and listen to the AED.
Okay.
So
Now, do you need to be certified to use this
Nope.
in any way? Okay.
nope. As long as you know how to work it.
Okay.
So you would turn it on, and it's going to tell you to attach the pads.
Okay.
And
So it actually gives you verbal instructions.
gives you verbal instructions and
that's
walk you-
interesting.
Now you know what? I did mess up.
What?
I didn't cover. You called for someone to go
Yes.
call 911.
Yes.
That's a big boo-boo. Excuse me.
Yeah.
So you called for somebody to call 911, and if
Right.
nobody came,
Yes.
you need to get on your cell phone,
Okay.
call 911,
Yeah.
put it on speaker, and put it next to you.
Right.
And they can even walk you through CPR,
Yes.
the dispatcher.
Well, two things with that.
Yes.
One, when I called 911 for my friend, they keep us on the line until they know they have someone coming.
Right.
So if somebody there has actually
If some,
dialed 911, you kind of know whether somebody's
so
on their
they
way or
should
not.
they should hand you the phone.
Yes.
They're going to want to talk to
Yeah,
you.
they asked me a million questions. Yeah.
So you put it, if somebody else called 911 for you,
Right.
they should put it on speakerphone and give it to you.
Yes.
And you lay it next to
Okay.
you so you can talk to the dispatcher.
Exactly.
So,
Yeah.
and if you don't have a phone around or
Right.
no one came,
Right.
you may have to leave and run and go get your
Yeah,
phone and come back.
it's more important to get somebody there.
else. Yeah.
And when I had caregivers, I always told them it was important to be under the instruction of someone from 911.
Yes.
Because, you don't want to be totally the only one responsible.
Yeah.
You want to have that partner,
Yes.
and
And you want that help coming.
yes,
Yes.
yes.
So
Well, we're
kind
at
of-
10 minutes, but we're good. But I wanted to give you some time
Okay.
frame.
So yes, that was back at the beginning when we
Right.
checked to see if he's responding. We called
Right.
for help.
Right.
So kind of skip through that little part.
Yes.
But yeah, make sure 911 is on the way and
Yes.
you're speaking to them on the cell phone as you go
Mm-hmm.
through. But so somebody brought you the AED,
Right.
and I'll turn it on. It's gonna
Okay.
sound something like this.
Apply pads to patient's bare chest.
Okay.
And then it's going to tell you to plug it up.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Okay, and that's there's an obvious.
Yeah.
If you
and
could
then,
see this, there's a blinking light. It's obvious.
Apply pads.
And then when it's
plug
time to
in
shock, the big orange button's going to blink.
Okay.
And you're going to, and it's going to tell you to clear, and it's going to tell you to shock. Now I'm going to turn it off so we can talk.
Yeah, so we can talk, right.
But yeah, it's the pads that you put on the patient's chest.
Right. They're like the size of a small cell phone.
Yeah. And it's got
And they're
pictures
Okay.
of exactly where they go.
Okay.
So
Perfect.
this one goes right on the right side under the collarbone.
Okay.
So I would take that off and put it right there.
Okay.
So all I got to do is look at the pictures. It's going to tell me what to do. And the other one goes on the left side under the, I would say under the armpit.
Interesting. I was guessing it would go in the same spot.
Yeah. So
Okay.
So what you're doing is you're sending an electrical signal
Yeah.
across the heart.
Right. That makes sense.
And then it's going to tell you to plug it up. So I would plug it up. And then eventually it's going to say clear and push the button. So you need to make sure you're
No
not
one else,
touching it.
yeah, is
and
around and
nobody-
nobody's touching
Or
it.
you're going to get shocked. Too.
Okay.
So yeah. And we leave the pads on. We
Right.
don't take them off. Ambulance is going to arrive and either hook up to your pads or put their own on there.
Okay.
But every 30, we'll leave them on, and it's going to start beeping for us
Okay.
to go back to doing compressions.
So that, okay.
And then every 2 minutes, it's going to stop and analyze again,
Okay.
and whether he needs to be shocked or not.
So not only is it transmitting the shock, but it's also reporting back to the device? Or
Yeah, it's going to stop and analyze again and
interesting.
say,
Whether the heart, there's some electricity going on and whether he needs more.
Yeah.
Okay.
whether it's got a shockable rhythm
Yes.
or not.
Wow. Boy, we live in a great age, don't we? I mean, think about, 50 years ago, we didn't have, or even less, there wasn't any of this. That's awesome. Okay.
So, yeah, it's a great thing to know where you are, where the AED is. And they're really trying to encourage more, to have one in the home.
Sure. The other device that I found interesting, and I've been wanting to order one, is the device, and I forget what it's called, but you put it over the mouth to suck anything
Yeah.
out that is lodged in your throat. Have you heard of those?
Yeah, I know
Not as part of CPR, but just if somebody's
it's
choking.
better to know how to do the hammock maneuver, though.
Yes.
And maybe have that as a plan B.
B, right.
But the hammock maneuver is a great thing to know, too.
You don't need any equipment. You don't need
No.
anything. You just,
You just put your
Yeah.
hand here. We'll take these off of him and show that real quick.
Okay.
Or try to describe it for
Yeah.
those listening in.
this is fun. I'm enjoying learning this.
So all you need to know, you're going to take your hand. You're going to make a fist.
Right.
And you take that thumb knuckle and you're going to find his belly button.
Okay.
And put it right over that belly
Okay.
button, right above it.
And would it normally be your dominant hand? Probably for most people. Yeah.
It would be for me.
Yeah.
And then, I'm standing behind him.
Right.
And I'm going to take the other hand,
Yes.
my left hand, and put it
Right.
on top.
Okay.
And then we're going to jerk in and
And
up.
up. Okay.
In and up. 1, 2, 3, 4, 5.
Okay.
And then after 5, your hand naturally wants to
Creep up.
and you don't want to try not to crack anything.
Right.
So I'm going to come back down and reevaluate after
Okay.
5. And I'm going to keep doing that, hopefully until he coughs it up.
Right.
And if he doesn't, then I would lay him down. We'd start CPR, but the difference is I'd check his mouth.
Mouth to see if it's in his mouth.
Yeah. But we never do a blind finger sweep.
Okay.
Only put your fingers in there and pull if you
Specifically
see something.
see something. Okay. That's good to know.
Yeah.
Good nugget to know. So now we'll talk a little bit. We have about 5 minutes, so let me talk about you and what you do.
Okay.
Now, you're here today because you mentioned that you teach people.
Okay.
And I felt like my audience and also some of the support groups that I belong to would find what you are teaching needed, helpful. How can they reach you, and where do you do these trainings? Do you have a studio? Do you give me a little bit of background?
I bring my stuff to you
Okay.
and do classes. So usually, a minimum 3 people,
Okay.
up to 12. It's limit of 12 because you want to make sure you have a good class and
Yes.
make sure everybody's getting it. But yeah, I do. I've done nursing home staff, and
Right.
some school staff, and I have the mannequins and all the equipment, and I come to you and do classes for your group or
Okay.
business.
All right. And do you negotiate what you charge, or is it a certain amount, or
Yeah, it's based on group size.
group size? Okay. Got it.
And we also, like I said, we have the blended learning also,
Yes.
which would be do most of the video at home and come and just do hands-on.
Okay.
If you need to already have been certified and need to be renewed, that's a good option.
So someone could watch your video at home, get the basics, come in, and then you're going to make sure that they know it?
Yeah, it's the American Heart Association tapes.
Okay.
The online video that they put out.
Okay. So when they do that combination, is it still a 3-hour program?
No.
Okay.
So yeah, it saves a lot of time.
Okay.
Yeah. It would be an hour to hour and a half depending on you want first aid and CPR.
Okay.
You know exactly what you want.
Interesting. And what's the bet now? We'll have the name of your company and probably the phone number on the video.
Okay.
But for the podcasters, how do they reach you? What's the best way to reach you?
I have email, and
Okay.
it's 901vitaltraining@gmail.com. And then my phone number is 901-308-4709.
Great. Is there anything else that you want to share? Story, or how maybe something that you did that helped someone, or I'm putting you on the spot. Something that jumps into your
I'm
head.
a respiratory therapist also.
Oh,
Yeah.
interesting.
I've been one for a very long time. And it's just amazing to see, I've been involved with lots of CPR at work, and to see these people make it,
Yeah. It's life-changing.
it is.
For them
it is.
and you.
And you just, see their family and everybody together again. It's a, just everybody should know it.
Well, I'm going to reach over, Mr. Jones, and shake your hand. Thank you so much for taking time to be
Thank you for
here.
having me. I'm honored.
And check us out both on the Aging in Memphis podcast, as well as the YouTube channel, which you can find links from my website, resource4care.com. Take care.
Bye-bye.
This is a simplified explanation of a CPR scenario. This does not take the place of a class. It's highly recommended that you take an actual certification class to become proficient in the knowledge and the hands-on skill to perform CPR.